Okay, this is part 3 of the digestive system. Um, we are down to the large intestine, so that's this structure right here, also called the colon. So by the end of the small intestine, by the time food reach the end of the small intestine, all that's left is water, indigestible food, and bacteria. And so what's going to happen in this part of the digestive tract is that a lot of that water is going to be reabsorbed. And that's because our body needs that. We don't want that to pass out with the rest of the waste product. We can also use a lot of the sodium or salt and potassium that's there, and so that gets absorbed. The other thing is that our colon is filled with bacteria that we have a symbiotic relationship with. We provide it with food, and that good bacteria does good things for us. So it prevents harmful bacteria from getting in and making us sick. And it also makes vitamin K, and it makes some of the B vitamins, and which we then absorb and our body uses. So this is good bacteria that we want in there. Whatever we don't need is leftover material, and that's delivered then finally to the rectum, which is this structure down here, and then to the anus, and then we get rid of it in the outside world. Our large intestine is about 5 feet long, and it's about 3 to 4 inches in diameter. Just by the way, we all have this good bacteria. So normal E. coli that's in our colon, it's the type that manufactures vitamin K, and we each have about 400 different species of bacteria, and it's unique to each individual. So every person has their own type of bacteria, or their own different combination of 400 different species of bacteria. I'm not sure if this is dating fun facts or not, but perhaps in some dates. The gassy facts. Gas accumulates in our intestine mostly due to what? Swallowing air when we eat, digestion of food by intestinal enzymes, breakdown of indigestible carbohydrates by bacteria, lack of exercise, or eating too much meat. And the answer is, in fact, the answer is number 3. So it's our own species of bacteria that breaks down what we consider indigestible carbohydrates or excess carbohydrates, and that's what produces gas. So bacteria produce this gas. There are essentially 5 gases in a fart. There is nitrogen, oxygen, carbon dioxide, hydrogen, and methane. And just by the way, methane is highly explosive, which is why Blue Angels, I don't know if you've ever heard of that term, but essentially lighting your passing gas is a highly idiotic thing to do, and it can cause a lot of damage and embarrassment in the emergency room. The smell of gas is determined by what types of bacteria that you have in the colon. So babies are essentially born with no bacteria, but they're almost instantly inhabited as soon as they are born. Vegetarians produce more gas than meat eaters. That's because they consume more indigestible carbohydrates. But most people produce between 200 to 2,000 mils of gas per day, and they usually release that gas in about 13 to 14 different passages. I had a question one year about noise. The noise of a person's fart is determined by the shape and the tightness of their sphincter, their anal sphincter, and has nothing to do with what they eat. Here's a look through the large intestine. So this is the ascending colon up here, this is the sigmoid colon, transverse colon, and this is the rectum. How long does it take for complete digestion of a meal? 2 to 4 hours, 6 to 12 hours, 12 to 24 hours, 24 to 72 hours, or more than 72 hours? And the answer is between 24 and 72 hours. Okay, star, 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 star. This is very common in the field. It's very common in the general population too. So essentially, if we consider that food is moving along that large intestine, it has to move through at such a rate that just the right amount of water is absorbed. If it stays in the large intestine too long, then too much water gets absorbed, and the feces, the material, becomes really, really hard and gets harder and harder and more difficult to kind of pass through the large intestine, and that's what we call constipation. So that can happen if the motility in the large intestine is very slow, and that can be caused by a number of different things, including aging, nerve damage, even emotional stress or lack of exercise can slow down that motility. And then it's just that the stools stay longer and longer and longer, and more water is absorbed, and as I said, then somebody becomes constipated. But this can also be caused by or related to things like a lack of fiber in the diet. Fiber is really important because it bulks up the stools, and it holds water in, so it keeps the stools soft. And the bulkier the stools are, they stretch the colon, and that causes them to reflexly do peristalsis. So by making the stools larger, you actually increase that motility. So large, soft stools, that's what you should really be aiming for in life. If we don't drink enough water, then that can also cause constipation. Failing to heed the call, so kids that don't want to go to the bathroom and just hold it, again, then more water is going to be reabsorbed. We'll talk about laxative abuse and how that causes constipation when we do laxatives in pharmacology, and side effects of medications. So some medications can affect the nerves and therefore the motility in this large intestine. Constipation can be quite serious, so it can lead to things like diverticulitis, which are little pouches that form in the colon, hiatal hernias, hemorrhoids, tears, and it can ultimately be life-threatening. So the best treatment of constipation is to try to prevent from occurring, and using what we call natural methods. So, dealing with all those factors we just mentioned. So making sure there's enough fiber in the diet, making sure a person is drinking enough fluids, they're heeding the call when the call is calling, and the person gets lots of exercise. All those things will increase motility and reduce the risk of constipation happening. As a last resort, we can use drugs that will increase motility or will soften the stools, and we'll talk about those in pharmacology. Diarrhea is the opposite of constipation. This is caused when food gets rushed through the large intestine, and so therefore not enough water is absorbed, and as a result the stools are very watery. So what causes food to rush through the large intestine are things like, if it gets irritated by a bacteria or a virus, then that irritates the lining, and that just causes an increase in motility, and suddenly you've got it's moving things through before the water can be reabsorbed. Of course, the real danger is that a person loses a lot of fluid and electrolytes. One of the dangers of constipation is hemorrhoids. Now, hemorrhoids are enlarged veins, like varicose veins in the rectal area. They can be internal, which is what we see in this particular picture, or they can actually be pushed right through the anal opening, and then we say they are external. Any activity that increases pressure in the anal area and the rectum is a risk factor for hemorrhoids. So this includes constipation. If somebody is straining to have a bowel movement, then it's going to put pressure in that area on those blood vessels, and the blood vessels may dilate. Things like prolonged standing or sitting, pregnancy, childbirth, there's a hereditary factor to this, and loss of muscle tone in the anal and rectal area. Just by the way, sitting on cold pavement is not a cause of hemorrhoids. Hemorrhoids can be painful, they can burn, they can cause itching, and of course they can bleed, and because these blood vessels are very close to the surface. So sometimes people will get a little bit of bright red blood on the toilet paper, and that's usually caused by a hemorrhoid. The last thing that we'll talk about, just very briefly, because I don't have an opportunity to go into a lot of detail, but inflammatory bowel disease is a group of diseases that affect the large intestine. Two of the most common are Crohn's disease and ulcerative colitis. And these cause inflammation in the lining of the small intestine and the colon, and then can even cause some ulcerations. And this is what you see. This is the inside of the large intestine. The underlying cause of inflammatory bowel disease is really unknown. There are some factors that can increase the person's risk, things like if it runs in families, so a genetic predisposition. They believe it's linked to immune function. Diet can have an effect, infection, and even psychological factors. So, for example, flare-ups may occur in times of stress. Symptoms of these include things like a loss of appetite, flatulence, abdominal pain, blood in the stools, which usually appears as kind of coffee grinds, right, when it comes from inside the colon, diarrhea and or constipation, and then, of course, this increases the risk of colon cancer. So things that they can do, they can try changes in diets. They try to decrease stress, so drugs that decrease anxiety and depression may be helpful. Anti-inflammatory drugs like steroids are often used, and then they can treat the diarrhea and or constipation as well. All right, this is the end of part 3. If you have any questions about this material, don't hesitate to contact me, and I will see you in class next week. Thanks.